We are back with Mark Van Arnhem with the North Carolina Navigator Consortium, and we are answering your phone calls. We have 25 experts who can go one-on-one with you until 6:30 tonight. The number is at the bottom of your screen. We're talking ACA healthcare enrollment, but for any of us with healthcare, and we get a bill from a hospital or a doctor's office, what should we do with that?
You should wait until you get your explanation of benefits, first of all. Many people are tempted to just go ahead and pay it right then, but it needs to go to your insurance company, and your insurance company needs to tell you what they're going to pay out before you pay anything. So just sit tight and wait for that explanation of benefits, and then at that point, you know, if you have additional questions about those your benefits through the insurance company, you can call your insurance company. If you've got marketplace insurance, you can call one of your navigators, the navigator that helps you, and we'll be happy to help you answer those questions.
All right, and so something different this year is that if your employer offers you health care, but it is too expensive to put your spouse, your children on, that kind of thing, your spouse and your children can look for ACA Marketplace.
That's right. The family glitch is a thing of the past, so your spouse, your children can look on the marketplace, and if your cost for your premium alone within your insurance company or with your private insurance employer offered is above about 8.5% of your annual income, that's deemed unaffordable for you as well. So you can also enter the marketplace and look for coverage as well.
Okay. When people talk about getting help with their application for the marketplace, what is included with that?
So we're going to sit you down and we're going to first talk about your needs, talk about any kind of conditions that you have that you might need to share with us so we can make sure that we're picking a plan that's right for you. We're going to dig in and correctly estimate your income because that's really important. That's going to tell you how much those advanced premium tax credits that you actually get to pay down your coverage. And we're going to make sure that we do that correctly because a lot of folks have a hard time with estimating their income, so they either get far less than they should get in premium tax credits, or they get too much, and then when they have to reconcile at the end of the year, you have to go through the taxes and reconcile that. There's fortunately a safe harbor provision for most folks, so they won't have to pay that back, but some folks do have to pay back any kind of tax credits that were given to them that were over what they were owed.
Okay, and so when people are applying for this kind of health care, they might be wondering what kind of paperwork or whatever am I going to need?
Bring your tax returns. That's a good start. Make sure you have your Social Security number. If you are an immigrant to this country, bring your documentation. You don't have to be a citizen of the U.S. to get marketplace coverage. You just have to be legally present in the U.S. So bring your documentation in, and we'll take care of the rest.
All right, so the marketplace has, again, dozens and dozens of healthcare plans for you to look at. The Navigator Consortium can help with that. A lot of people are kind of sometimes don't feel like they should call the insurance company, right? Because they feel like it's going to charge them.
Yep, and we're not going to charge you, and we're going to give you a real unbiased look at all of the policies that are available to you in your area. So we make sure that you're not just looking at, you know, Blue Cross Blue Shield or Aetna or any of those. You're looking at the whole picture to make sure what you're getting is the right plan for you, because oftentimes it may be a different health plan that maybe you didn't even know existed. It may be Friday Health or Oscar, which is also on the marketplace. So it just depends.
Is there a common mistake most people make when it comes to healthcare?
Common mistake most people make when it comes to healthcare is, first of all, not having health insurance. I tell people all the time, we all have insurance on our cars. You wouldn't drive your car down the street without having insurance on it. Don't take your body anywhere without having insurance on that. It's the most important thing you have. But the second most common mistake that people make with health insurance, especially through the marketplace, is thinking it's too unaffordable and that they will never be able to afford it.
So get with someone and talk with them. All right. And so that number at the bottom of your screen, 855-733-3711. These experts are here until 6:30. So this is your time to get help. Thank you so much for joining us. We appreciate it. These experts, again, they're hanging around till 6:30, so make sure you get there.